All right, I was watching TV this morning and I saw an ad for, well, it was a free vein screening, and the pictures that came up stopped you in your tracks. But I know so many of you out there are dealing with painful varicose veins. Dr. Hadjbian is joining us. He is from the Vein Institute of Utah, and it was his commercial that I saw this morning about this free screening. What will you be doing today?
We're going to be looking at patients and assessing if they're good candidates for vein treatment. So if they have varicose veins, if you have symptoms like aching, swelling, cramping, heaviness, if you have an open wound on your ankle, if you have large varicose veins, or if you just have the symptoms of it, we would like to see you. We need to see you to assess to see if you're a good candidate for treatment.
Is what we're looking at right here part of how you assess those?
We do. That's an ultrasound. We don't do an ultrasound on our screening day, but we assess to see if you're a candidate to move forward, and that's the next step in most vein treatment patients, is an ultrasound study.
I like that we saw a man in that video. This is not just a women's issue.
No, not at all. Men tend to wait very long time, and I seem to see some of the worst cases of vein disease in men because they wait till it's at its end stage. And we would like to see those earlier so we can treat them earlier and prevent a lot of those things from happening.
If they're not hurting yet, if you put off treatment, will that eventually happen? Will they just get worse?
There's a percentage of patients, almost all patients will get worse, but there's a percentage that leads to venous ulcers and blood clots in the legs, different problems that we can prevent by fixing the veins.
So we always talk about looking great, but this really is not just about how your legs look, it's how you feel.
This is about quality of life. This is about symptoms. To me, treating the veins cosmetics is the last step. It's about making healthy legs and people so they can function better.
How long is the process?
It depends on how bad their veins are. It can take anywhere from 1 or 2 sessions of vein treatment to several, depending on how severe the disease is.
So maybe if you're planning a vacation coming up this summer, it's the end of January.
Get started early.
Yeah.
There's 2 issues with that. One is insurance companies have some wait times before they allow treatments to be done. So last year we had a lot of patients that came in, October and November and had to be done by the end of the year, and it was impossible to get them done just because of the insurance rules. And some of them, it was just too complicated. They couldn't be done by that time. It's not a get in, get out, quick fix thing sometimes, and so we don't ever want to promote that. We want to promote healthy legs. Each individual treatment is very quick. It takes half an hour to an hour to do, but sometimes you need several to be finished.
I think a lot of people are scared of the treatment because in the past it's been
surgery.
Right.
We don't do surgery.
This is different.
It's lasers and injections. We can do the entire vein treatment without any surgery. We do pull some small veins through a procedure called phlebectomy at times, which leaves little tiny micro punctures when we do it, and then it heals, but we don't have to do it that way. In fact, I pioneered some of the procedures in Utah that require no surgery at all.
I know Gretchen went through this and said she was so surprised at how easy this was and how much it changed.
You walk in, you walk out.
For her, how she was feeling about her legs. All right, this free screening is such a great time for you to say, is it time for me to do this? Do I need to have this done? Dr. Hadjbian can answer those questions. It's today from 10 to 5. Please call their office. It's located in Sandy, and the phone number is right there. Call to schedule an appointment, and they can make sure that you either get in today or at another time. Dr. Hadjbian, thank you so much for being here. We'll have all that info on our website, everybody, and we'll be right back.